Every day, millions of seniors take a tiny pill like amlodipine, losartan, or lisinopril, believing their blood pressure is perfectly managed. But behind that daily routine lies a series of silent critical adjustments and hidden side effects that rarely make it onto the prescription label. There are specific, timing-dependent reactions, nutrient depletions, and subtle warning signs that most people over 60 completely miss until a major complication arises. If you are relying solely on that morning capsule to keep you safe, you might be overlooking the exact variables that dictate whether these medications protect your health or inadvertently compromise it. Hi, I'm Dr. Liam Cooper. Over my 2 decades of experience in clinical medicine and senior cardiovascular health, I have watched thousands of patients navigate the complexities of managing hypertension. What I have learned in those 20-plus years is that treating high blood pressure in your 60s, 70s, and 80s is radically different than treating it in younger adults. Your kidneys handle filtration differently. Your vascular walls have unique stiffness, and the way your body processes these specific drugs changes over time. That is why simply taking your dose and walking away isn't enough. Today we are going to pull back the curtain on what is actually happening inside your body when you take these 3 blockbuster medications. We will explore the critical differences between how a calcium channel blocker like amlodipine affects your limbs, how an ACE inhibitor like lisinopril alters your lungs, and how an ARB like losartan manages your kidneys. More importantly, we will uncover the vital blind spots that your standard 5-minute doctor's visit completely skips. Let's dive straight into the unique mechanics of these medications and the first major warning sign you need to look out for. To truly understand what your body isn't telling you, we have to look closely at the exact mechanics of how these 3 distinct medications alter your cardiovascular system. They are not interchangeable, and they do not work the same way. When a doctor diagnoses hypertension, they are essentially looking at a plumbing system under too much strain. The way amlodipine, lisinopril, and losartan relieve that strain represents 3 completely different medical strategies, each with its own set of hidden rules that seniors need to navigate. Let's start with amlodipine. This medication belongs to a class called calcium channel blockers. Think of your blood vessels as tightly coiled springs surrounded by tiny muscle cells. For these muscle cells to contract and tighten the vessel, they need calcium to flood in. Amlodipine acts like a cellular bouncer, blocking that calcium from entering. As a result, the smooth muscles surrounding your arteries are forced to relax and widen. While this does an excellent job of dropping the overall pressure inside the pipes, it creates a profound structural shift in how blood flows, particularly in your lower extremities. Because the vessels are completely relaxed, gravity begins to pull fluid downward, which leads to a very common yet poorly understood side effect: severe ankle and foot swelling, known medically as peripheral edema. Many seniors mistake this fluid retention for sudden heart failure or a kidney issue, when in reality, it is a direct mechanical consequence of how amlodipine forces your blood vessels open. Lisinopril steps in to block the enzyme responsible for creating this chemical. By keeping angiotensin 2 levels low, your vessels remain open and relaxed. However, because this enzyme is blocked, a completely unrelated chemical called bradykinin begins to build up, specifically in your respiratory tissues. This accumulation triggers a dry, hacking, persistent cough that no cough syrup can fix. For a senior, this chronic cough can easily be misdiagnosed as bronchitis, asthma, or a lingering cold, causing months of unnecessary discomfort simply because the chemical pathway was altered. Finally, we have losartan, which is an angiotensin receptor blocker, or ARB. Losartan is often prescribed when a patient cannot tolerate the lisinopril cough. Instead of stopping the production of angiotensin 2, losartan allows the chemical to be made but sits directly on the cellular receptors, blocking the hormone from delivering its squeeze signal. While ARBs are exceptionally gentle on the lungs and highly protective of the cardiovascular lining, they fundamentally alter how your kidneys manage vital minerals. Because the signal to retain certain fluids is muted, your kidneys begin to hold on to potassium while flushing out sodium. For an aging body, this shift requires a delicate balancing act that can easily go unnoticed without precise monitoring. Now that you understand how these medications fundamentally alter your plumbing and chemical pathways, we need to look at the hidden timeline of when you take them. For decades, the standard medical advice was simple: take your blood pressure pill first thing in the morning with breakfast. But what many seniors are never told is that your body's cardiovascular system operates on a strict 24-hour internal clock, and matching your medication to that rhythm can mean the difference between robust protection and a sudden midnight emergency. This brings us to a critical medical phenomenon known as the morning surge. Naturally, your blood pressure is supposed to drop by 10 to 20% while you sleep, allowing your heart and blood vessels a much-needed period of rest. However, as dawn approaches, your body releases a wave of stress hormones like cortisol and adrenaline to help you wake up. This causes a sharp, sudden spike in both your heart rate and your blood pressure, right as you open your eyes. Because of this natural biological surge, statistical data shows that the risk of experiencing a stroke, heart attack, or sudden cardiac event is highest between the hours of 6 a.m. and noon. Here lies the problem with the morning dosing routine. Medications like Lisinopril, Losartan, and especially Amlodipine generally take anywhere from 4 to 8 hours to reach peak concentration in your bloodstream after you swallow them. If you take your pill at 8 a.m., it won't offer full, maximum protection until early afternoon. Even worse, by the time you wake up the next morning, the medication from the previous day has reached its lowest point of effectiveness, leaving you completely exposed during that highly dangerous morning surge window. Clinical trials, including the landmark hydrochronotherapy trial, have revolutionized how we look at this timing. Researchers discovered that when patients shifted even one of their blood pressure medications from the morning to right before bedtime, their risk of cardiovascular death, heart attack, and stroke was cut nearly in half. By taking a medication like Losartan or Amlodipine at night, you ensure that the drug hits its peak strength exactly when your body needs it most, during those vulnerable pre-dawn hours. Furthermore, for drugs like Amlodipine, sleeping horizontally helps counteract the gravity-driven ankle swelling that plagues so many daytime users. However, switching your schedule isn't something you should do blindly tonight. Moving a dose to the evening can occasionally cause blood pressure to drop too low while you sleep, a condition called nocturnal hypotension. For a senior, this can manifest as intense dizziness if you have to get up in the middle of the night to use the restroom, drastically increasing your risk of a dangerous fall. It requires a personalized approach, looking closely at whether your body is a dipper, meaning your pressure naturally drops at night, or a non-dipper, where your pressure stays dangerously high through the evening. This single distinction dictates your entire ideal dosing schedule. Beyond the timing of your dose, there is an invisible war happening inside your body that involves the crucial relationship between these medications and your essential nutrients. When you take a prescription drug every single day for years, it doesn't just manage your blood pressure. It alters how your body absorbs, processes, and excretes vital minerals. For seniors, this can trigger a slow, silent depletion of nutrients that leads to severe fatigue, muscle weakness, and neurological changes, symptoms that are frequently and mistakenly blamed on just getting older. Let's look closely at how amlodipine interacts with your body's chemistry. Because amlodipine is a calcium channel blocker, it works at the microscopic level to keep calcium from entering the muscle cells of your blood vessels. While this is highly effective for relaxing your arteries, it can fundamentally disrupt how your cells handle other minerals, most notably zinc and potassium. Over time, this cellular shift can lead to subtle nutrient imbalances that manifest as unexplained muscle cramps, chronic fatigue, and even changes in your sense of taste or slow wound healing. Because these symptoms develop so gradually over months or years, seniors rarely connect them to their daily blood pressure capsule. The mineral stakes are even higher when we look at Lisinopril and Losartan. Both of these drugs impact a hormone loop called the renin-angiotensin-aldosterone system, which controls how your kidneys filter waste. Under normal circumstances, your kidneys balance sodium and potassium. However, when Lisinopril blocks the production of angiotensin II, or when Losartan blocks its receptors, it signals your kidneys to aggressively flush out sodium and water while holding on to potassium. This can easily lead to a condition called hyperkalemia, or dangerously high potassium levels in the blood. While we are always told that potassium is good for our hearts, too much of it is incredibly dangerous. High potassium doesn't always show obvious symptoms early on. It builds quietly, occasionally causing mild nausea, muscle numbness, or a fluttering feeling in your chest. If left unchecked, hyperkalemia can completely disrupt the electrical signals in your heart, leading to life-threatening arrhythmias. This risk skyrockets for seniors because kidney function naturally declines with age, making it much harder for the body to filter out excess minerals. What makes this situation worse is that many seniors trying to eat healthily will unknowingly compound the problem. If you are taking Losartan or Lisinopril and decide to use a commercial low-sodium salt substitute to protect your heart, you might be put in immediate danger. Almost all of these salt substitutes replace sodium with potassium chloride. Adding a potassium-heavy seasoning on top of a medication that already forces your body to retain potassium can push your blood levels into a critical zone. Understanding these hidden chemical reactions is the only way to truly protect your cardiovascular system from unintended harm. While managing your mineral levels is critical, there is another massive blind spot that catches many seniors completely off guard. The hidden dangers lurking right inside your kitchen, specifically regarding the foods and over-the-counter medications you pair with your daily prescription. It is a common misconception that once a drug is swallowed, it works entirely on its own. In reality, the everyday choices you make at the breakfast table or the pharmacy aisle can either completely deactivate your blood pressure medication or amplify it to a highly dangerous degree. Let's start with a major dietary culprit that specifically targets amlodipine, grapefruit. Many seniors love starting their morning with half a grapefruit or a glass of fresh juice, believing it to be a heart-healthy choice. However, grapefruit contains active compounds called furanocoumarins. These compounds travel to your liver and completely deactivate a crucial enzyme known as CYP3A4. This specific enzyme is the primary workforce your body uses to slowly break down and clear amlodipine from your system. When you block this enzyme with grapefruit juice, your body loses its ability to metabolize the drug. As a result, the amlodipine builds up in your bloodstream to toxic concentrations. Instead of receiving your steady, controlled dose, it is as if you took 3 or 4 times your prescribed amount. This can cause your blood pressure to crater instantly, triggering severe dizziness, confusion, rapid heart palpitations, and a dangerously high risk of fainting and falling. What surprises most seniors is that this effect isn't temporary. A single glass of juice can paralyze that liver enzyme for up to 24 hours, meaning you cannot simply space out your dose and your breakfast. On the opposite end of the spectrum, there are everyday items that completely neutralize your medications, and the most common offenders are over-the-counter painkillers. As we age, managing joint pain, arthritis, or minor aches becomes a daily reality. Many seniors routinely reach for non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or naproxen. What they don't know is that NSAIDs work by blocking chemicals called prostaglandins, which naturally keep your blood vessels relaxed and open. When you take ibuprofen alongside lisinopril or losartan, you are creating a direct chemical contradiction. The blood pressure medication is trying to open the vessels and protect your kidneys, while the painkiller forces the vessels to constrict and reduces blood flow to your kidneys. This interaction doesn't just cancel out the blood pressure-lowering benefits of your prescription. It places an immense, acute strain on your renal system. For a senior whose kidney filtration rate is already naturally slowing down, combining an NSAID with an ACE inhibitor like lisinopril can trigger sudden, acute kidney injury within just a few days of use. As we examine how these medications interact with your diet and over-the-counter painkillers, we must confront another major blind spot that is rarely discussed in a standard medical checkup: the dangerous phenomenon of orthostatic hypotension, or what is commonly known as postural dizziness. This condition represents a hidden, daily physical hazard for seniors taking amlodipine, losartan, or lisinopril, and it is one of the leading underlying causes of emergency room visits due to severe falls. To understand why this happens, we have to look at how an aging body adapts to gravity. Under normal circumstances, when you stand up from a sitting or lying position, gravity immediately pulls blood downward into your legs and abdomen. To prevent blood from rushing away from your brain, your body relies on a specialized network of internal pressure sensors called baroreceptors, located in your neck and chest. In a split second, these sensors detect the drop in pressure, fire off a signal to your nervous system, and cause your blood vessels to constrict instantly while slightly increasing your heart rate. This rapid mechanical reflex pushes the blood back up, ensuring a steady oxygen supply to your brain. However, as we cross into our 60s and 70s, 2 things happen simultaneously. First, These internal baroreceptors naturally become less sensitive and slower to react. Second, you are taking a daily medication explicitly designed to prevent your blood vessels from constricting. If you are on amlodipine, your vessels are chemically blocked from tightening. If you are on Lisinopril or Losartan, the chemical signals that trigger rapid vessel constriction are muted. The result is a dangerous lag time. When you stand up quickly, whether it's getting out of bed in the middle of the night or rising from your favorite armchair, your blood pools in your lower limbs. Your treated cardiovascular system cannot react fast enough to counteract gravity, and your brain experiences a sudden, temporary drop in oxygen. This manifests instantly as a wave of lightheadedness, blurred vision, or a feeling that the room is spinning. For a senior, this brief moment of instability is incredibly hazardous. If you experience this dizziness, your immediate instinct might be to reach out to steady yourself, but if the drop in pressure is severe enough, it can cause transient syncope, a brief fainting spell. Navigating this requires a deliberate change in your daily physical habits. Instead of springing out of bed, seniors taking these medications need to practice a phased awakening. Sit on the edge of the bed for 30 to 60 seconds. Allow your vascular system to stabilize under the medication's influence, and only then stand up slowly. Recognizing this physical lag is a vital step in maintaining your independence and avoiding a catastrophic injury. We have covered the mechanics, the timing, the nutrient traps, and the physical risks of daily movement. But there is one final, critical piece of the puzzle that remains largely misunderstood: the concept of treatment fatigue and the dangerous trap of self-adjusting your medication. As a physician, I frequently see patients who have been on stable doses of amlodipine, lisinopril, or losartan for years, only to experience sudden, unexplained complications. Often, the culprit isn't the medication itself. It is the subtle decline of other organ systems that were healthy when the prescription was first written. Your body is a dynamic, shifting landscape. A dose that was perfectly calibrated at age 60 may become an overdose by age 75 as your liver metabolism slows down and your kidney glomerular filtration rate, GFR, naturally declines. Many seniors assume that because they have stable high blood pressure, they no longer need frequent monitoring. This leads to a dangerous set-it-and-forget-it mentality. However, these medications require active, ongoing titration. For example, if you begin taking a new supplement, start a different medication for acid reflux, or even change your exercise intensity, your physiological need for these drugs shifts. I have treated patients who began experiencing chronic fatigue and brain fog, only to find that their blood pressure was bottoming out at 90/60 because their baseline needs had dropped. Yet their prescription remained locked at the higher original dose. Conversely, there is the risk of rebound hypertension. If you skip doses because you feel fine, or because you experienced a minor side effect like a dry cough, your blood vessels can react with a rapid, exaggerated constriction. This rebound effect can drive your blood pressure higher than it was before you started treatment, increasing the immediate stress on your heart and potentially triggering a hypertensive crisis. This is why your role in this process is active, not passive. You must become a partner in your own care by tracking your metrics. I recommend that every senior on these medications maintain a simple blood pressure log, not just the numbers, but the time of day, the context, such as before or after taking your dose, and a note on how you feel. If you notice a trend where your systolic pressure, the top number, consistently drops below 110 or spikes above 140, that is not a signal to change your dose yourself. It is a mandatory signal to schedule a review with your provider. Your goal is not just to lower a number on a chart. It is to maintain the delicate equilibrium that keeps you mobile, alert, and safe. Your medication is a tool, but you are the architect of its success. Uncovering these hidden mechanics, timing nuances, and nutritional shifts is the ultimate key to ensuring your medication works for you, rather than against you. Managing high blood pressure after 60 is never as simple as just swallowing a daily pill. It requires active tracking, consistent communication with your care team, and a deep understanding of how your body's internal chemistry changes over time. By staying vigilant about your lab work, remaining mindful of your physical movements to avoid sudden dizziness, and matching your dosing schedule to your body's natural 24-hour biological rhythm, you can completely transform your long-term cardiovascular health and protect your independence for decades to come. I'm Dr. Liam Cooper, and my goal is always to provide you with the deep medical insights you need to confidently take charge of your wellness journey. Please remember that the information shared in this video is for educational and informational purposes only. It should never be used as a substitute for professional medical advice, a formal diagnosis, or a customized treatment plan from your personal physician. Every individual's cardiovascular system is entirely unique, and you must always consult with your doctor or healthcare provider before making any modifications to your daily medication schedule, dietary habits, or over-the-counter pain management routine. If you found this advanced breakdown helpful and want to discover more hidden clinical insights that can help you or your loved ones age with strength and vitality, you must subscribe to the channel. Make sure to like this video, leave a comment down below with your thoughts or your own experiences with these medications, and share this with someone who needs to hear it. Take care of yourself, stay informed, and I will see you in the next video.